the 3 different types of pain that you may encounter after having surgery, and the different ways or measures that you can do to address these different types of pain. One item that patients note when they first get out of surgery is incisional pain, which is very clear that they're going to have incisional pain because they just had surgery. The pain's going to be at the incision sites where the ports were placed during the surgery. The amount of incisions that you have across your mid-abdomen will be anywhere between 5 to 6 entry points for the ports. The incision that you may note that's the most painful of the incisions across your abdomen is the incision near the belly button. This is the incision that is used for, one, the camera, as well as it's utilized for the extraction site for removing the prostate at the end of the OR case. The other region that you can get incision pain is also the region where your prostatectomy was done. So you will not see any incisions because all the entry points are up in your abdomen. However, you're going to be sore near your rectum. So if you feel tender to touch, soreness with movement, that's incision pain, and that could be across your abdomen where the port sites are, as well as near your scrotum, like between the scrotum and the rectum. In those regions, those areas can be painful. Best way to manage that is wearing an abdominal binder to support your belly, so when you're moving around, it doesn't hurt as much. Icing as much as you can right after surgery. You really can't overdo it because ice melts. So putting an ice pack on your belly whenever it's sore or tender to touch, as well as near your peritoneum, which is the space between the scrotum and the rectum. Icing those regions are going to make it so it's nice and numb, reduces the swelling, and you won't have as much inflammation, and the incisional pain won't be as bad, and you won't feel as tender. So that's one way of managing your incision pain, wearing your abdominal binder, icing regularly. The other item you should be doing is I would recommend taking Tylenol on a scheduled basis. You will be getting this after surgery, as well as once your lab work has been evaluated on the postoperative day 1, you will then be eligible to be on ibuprofen that you could take in addition to the Tylenol. And the combination of taking both Tylenol and ibuprofen will give you a great anti-inflammatory effect, and you'll get a good relief from your pain by taking this medication that doesn't have too many side effects associated with them. Another item you can do to help with your incisional pain is you can take the narcotic that you'll be offered immediately after the surgery, either in IV form or oral form. Preferably, if you're able to tolerate oral intake, I would recommend taking the oral form, because then that medication will stay in your system longer rather than the IV form. In addition to that, it's a good idea that you be mindful not to overdo your activity. And I'm saying this for the first several days after surgery. So be mindful of that while you're in the hospital. It's good to do a little of activity a lot through the day, not too much at once. As well as when you go home, just be mindful of only doing a little at a time and not too much at once, because it's always easier to add more, but it's impossible to take away. So that's one pain I really want to make sure that you really knew that you can have. So incisional pain, tender to touch, so across your abdomen, in between the scrotum and the rectum and the peritoneum space. That's incisional pain, and the management to review again: abdominal binder, icing, Tylenol, ibuprofen on a scheduled basis for several days after surgery, a narcotic pain medication if you need it, as well as being very mindful about your activity. One other thing I want to add on incisional pain and management: if you are having significant pain between the scrotum and the rectum, the peritoneum space, I would recommend sitting on a waffle cushion that you'll be getting here in the hospital. It disperses the pressure, so when you're sitting for any lengths of time, you're not going to have as much pressure in that area that essentially your surgery is done on. The second type of pain that I want you to know about is gas pain. It tends to be the worst one of all of them. It's the one that brings people to their knees, and they think that they're dying, but they're not. It's the same pain that makes a newborn scream in the middle of the night. Now, you're probably asking, how do I differentiate gas pain from incisional pain? So, recap, incision pain is tender to touch and with movement. Gas pain, it's colicky, it's all throughout your belly, sharp like a knife, it comes on real quick and it goes away real quick. And you really can pinpoint it. It's like here, and it's here, it's here. And often it's associated with your abdomen being a bit distended as well. So that's kind of the quality of gas pain. The best way of managing gas pain is not having an emphasis on medication, since often narcotic medication specifically can make your gas pain worse, since it slows down your bowels in the long run. The best way to manage your gas pain is you moving yourself. The more active you are, the more you're likely to help wake up your bowels. I know I just told you a lot through the day. However, you still can do a lot, but in little doses a lot through the day. So it's very important, if you're very gassy, to get out of bed and move, to get that gas bubble to move. Another thing that you can do to help with that gas pain is putting heat on it. Now, I know I just told you to put ice in your incision for incisional pain, but if it's not incisional pain and this gas is bothering you, heat helps you to relax, and it's going to help soothe your stomach from being too tight, and it'll help you be able to pass that gas a little bit better. Other thing you can do for the gas stuff is prevent it. And how you prevent it is don't eat things that are going to make you gassy. Now, I really don't know exactly what makes you gassy, so you probably should be mindful of the items in the past that you've eaten that make you gassy. Don't eat those right now. Now, if you really have no clue what are the items that make you gassy, a good rule of thumb is staying away from cruciferous vegetables, broccoli, cabbage, kale. Another item, it's probably not a good idea to drink carbonated beverages right now because it's full of gas, and guess what? You're full of gas. So the more carbonation you're drinking, the more gassy you're likely going to be, since you're not passing your gas. And then when you do eat your food, besides what you're eating, it's actually more important the quantity, because where all this gas is coming from, the gas is coming from that your bowels are not moving. So having surgery, abdominal surgery of any sort, laparoscopic or open, put your bowels to sleep. So your normal bowel activity, which is like this all throughout the day, goes like this, and it's locked up, and you have to wait for your bowels to wake up again. So with you, when you're eating, you really want to make sure that you're avoiding adding to that, as well as you don't want to eat too much of things, because if your bowels are like this, where's the food going to go? So it's just going to make you even more distended. So you should probably eat small meals a lot through the day, nothing too heavy all at once, because last thing you want to do is have a brick in your stomach. And then what happens then is you'll get nauseated and vomit, and you'll think really bad things and scare people, and you don't want that. So for your gas issues, one, you should do small little meals throughout the day. Avoid things that are going to make you gassy. Be mindful of how much narcotics you're taking. I'm not saying you can't take narcotics, pain medication, but just be mindful that when you do take narcotic pain medication, it slows down your bowels. And then get up and walk, because the more you're moving around, the more the gas is going to move for you. Another thing I really want you to know about with the gas, the duration of what to expect, how long you'll have it. Usually the gas comes on postoperative day 1, towards the end of the day, and you could tend to have it for a good, gas issues it takes usually a day or 2 to pass gas, and it takes 3 to 5 days to actually have a bowel movement, and 2 to 4 weeks to get back to what you were before surgery. So in that time frame, you can be gassy. But I want to make sure that you knew that expect 1 or 2 days it'll take you to pass gas, 3 to 5 days to have a bowel movement, as well as it'll take 2 weeks to a month to get back to your normal bowel function. So the third type of pain that I want to review with you is bladder spasms. It's very common when you have bladder spasms. How it will feel like is pressure, feeling like you need to void or have to have a bowel movement. The time period that you will have the bladder spasms, or they're more common, is right when you first get out of surgery, as well as when you're up and moving around a lot, because when you're up and moving around a lot, the catheter can rub on your bladder and make your bladder think that it'll basically trigger your bladder to spasm. So how to handle these items is, one, if you feel like you have to urinate, have to have a bowel movement, pressure, or that bladder spasm, first thing you should think of is my catheter draining well? Because if your catheter is not draining well, it doesn't matter how many pills you take and how little activity you've done, you're going to continue to have the bladder spasms, and they're going to even get worse. So make sure your catheter is as far away from you as possible, draining to gravity, and you're emptying it regularly. If it's not the catheter that's triggering the spasm, then it's likely due to something that's making your bladder sensitive. Either 1, just had surgery, or 2, overactivity and having the catheter rubbing your bladder. If it's those items, then the thing to help with the bladder spasms is taking your anti-bladder spasm medication, which is ditropan, or other name is oxybutynin. Key thing about that medication to be mindful of, you need to stop it 24 hours before catheter removal, since it will make your bladder go to sleep. And when they take your catheter out and your bladder is asleep, it's going to be very hard for you to be able to empty fully your bladder, and that will be a problem. So those are the 3 types of pain I wanted to review with you. I hope this has helped you.